to cut down on your, fats and meats and everything else and come to a more vegetarian with fresh fruits and stuff like that. And they had very strict dietary regimes, and that they would enforce that on the patient. The second line of this was simple drugs or herbs. And then there were compound drugs, which included minerals and stuff like that as well.
So we've talked about practices. Let's talk now about the people. There were some key Muslim physicians who contributed, of course, back then.
Absolutely.
And
yes.
continue to contribute to modern medicine today?
Well, some of their, like one of the very famous physicians was Al-Razi. He was born in what is now Tehran, Iran, Persia, and he practiced there in the turn of the first millennium, somewhere about 930 of the Christian era. He set the principles of how to train physicians. He also was the first one to find a very notable hospital called the Adudi Hospital. In fact, the concept of the hospital was first developed during the Islamic period. Before Islam, there were no real hospitals. There were temples where patients would go and the priests would treat them. But the concept that the patient has to be brought to one place where doctors could treat them is a very Islamic concept. And that's the hospitals were developed during the Islamic period.
Were they called hospitals?
Bimaristan, the Arabic word for hospital. In fact, that was the first one that was used. Bimar is sick, and stan means place, a place for the sick. And that's how the hospitals got started.
How do you think that the importance of this as part of education fell away? Like, why do we not know that?
Well, I think that so many advances have taken place now that people have, it's not necessarily Islamic history. We don't know very little about Greek history, Greek medicine. We know very little about Chinese medicine except for acupuncture. I went to China, and there's much more than just acupuncture for treatment of people, the Chinese medicine. They also have herbal medicine and so forth. So I think that it is just the lack of trying to research out the ancient methods and the historical methods of treatment is what is lacking.
As you go through your day-to-day life as a practicing surgeon,
yes.
How often do you think, or how much are you aware that what you are doing today relates back to this?
Well, as I said, that the first time that I really got interested in this book was when I read about a varicose vein operation, how to strip the varicose vein. It's described 1,000 years ago, exactly the same way.
Why did they care about varicose veins? Was that a vanity or a health issue?
Well, no, because they would bleed sometimes, and a person could bleed to death.
Okay, because now we tend to think about, varicose veins, they're ugly.
Exactly.
Which makes my mind think, were there vanity issues back then?
I'm sure there were. There must have been vanity issues as well, yes.
But there weren't plastic surgeons
no, there
back
were no
then.
plastic
That's very
surgeons.
much a modern development.
That's right.
So what would you say, if you had to point out the greatest similarity between Islamic medicine and modern medicine, and the starkest difference between the two? So first,
well, I think the sophisticated operations that we do now, like the open heart surgery and all, could not be envisaged at that time because, the cavities, especially like the chest or the abdomen,
so that's
that was a no-no at the time because people would die if you operated on the chest or something like that, or if people actually were injured in the chest, they were supposed to die. That's it.
And the greatest similarity?
Well, the similarities is the method and the system. As I said, the concept of the hospital was developed. We assume for granted, for instance, now that when you go to a hospital training program, you are a resident, you are a fellow, and you are a junior staff and a senior staff. This method existed even during the Islamic period.
Well, thank you for enlightening us. I know that IIIM is going to continue to work to enlighten as much of the world as possible.
Right, absolutely.
And we appreciate you joining us today, Dr. Nagamia.
You're most welcome.
Thank you very much. To learn more about the work and the current research of the International Institute of Islamic Medicine, you can visit the website at iiim.org. This episode of Up Close may be viewed in its entirety at wedu.org. Thanks for watching. I'm Cathy Unruh, and I'll see you next time on Up Close.
This special presentation was produced in high definition by WEDU, Tampa, St. Petersburg, Sarasota.